Arrhythmogenic right ventricular cardiomyopathy, ARVC. It is also known as arrhythmogenic right ventricular dysplasia or ARVD. It is an inherited cardiovascular disease. Symptoms are same as that of hypertrophic obstructive cardiomyopathy, which is syncope and sudden cardiac death, and it is the second most common cause of sudden cardiac death in younger patients. Coming to pathophysiology, it is an inherited autosomal dominant condition in which the right ventricular myocardium it is replaced by fatty or fibrofatty tissue. There is also a genetic mutation which involves in 50% of the patient encoding the components of desmosome protein. Investigation of ARVC involves ECG abnormalities, which specifically there are two abnormalities. Number one is T wave inversion in V1, V2, and V3. And the second one is the epsilon wave, which is seen in 50% cases of ARV. It is basically a positive deflection at the end of the QRS complex, as seen here. The echo findings in case of ARVC shows hypokinetic right ventricular with thin free wall. And the MRI may be done, which is useful to show the fibrofatty tissue. So the questions in the exam comes regarding epsilon wave and the T wave inversion in V1, V2, V3, and the scenario may be same as that of uh, hypertrophic obstructive cardiomyopathy. Coming to the managements in these patients, they have palpitations, arrhythmia, which is controlled by sotalol, which is a beta blocker, and the ventricular tachyarrhythmias or tachycardia is basically controlled with catheter ablation. In some cases, implantable cardioverter defibrillator is also used.